Hi, my name is Dr. Sean at Alaska Healing Arts Chiropractic and Rehab, and we're going to go over a little assessment that we use in the clinic here to diagnose either a tension type or a cervicogenic type headache. So we're going to take a look at the muscles, nerves, and joints in the neck. Alrighty, so first couple muscles that we're going to take a look at is called the sternocleidomastoid here on the front lateral aspect of the neck. This muscle starts all the way up at the base of the head at what's called the mastoid process, and then it travels down and actually has two branches, one that goes to the sternum and one that goes to the clavicle. That's why it's called sternocleidomastoid. So that's one that we might palpate and look for some trigger points, some tender points. Commonly, if that muscle is a contributing factor or causative of a tension type headache, we'll actually be able to find a trigger point or a tender point that will reproduce the headache. Second is the upper trap. So this is that upper most part of the trapezius muscle, starts all the way out at the shoulder and runs all the way up to the base of the head. And again, we would palpate through that muscle to make sure that we're looking for any of those trigger points, tender points that when we push on them starts to enhance or recreate that headache. So for palpation wise, that's what we're going to use to really diagnose a tension type headache. We're going to do that on both sides, make sure that we're keep an eye out for any reproduction of any headaches or anything like that. Second, for a cervicogenic headache, we're going to use one test and again palpation. The test is called flexion rotation, and so we're looking for any reproduction of the headache or an increase in the sensation of the headache when we get to the end point of the test. So what we're going to do is we're going to lift the patient's head up, we're going to tuck the chin, we're going to rotate all the way to one side, and we're going to ask them, does that make the headache worse? If yes, that'd be a positive test. We're going to do the same thing on the other side. Again, we're looking for, does it make that headache worse? If yes, that would be a positive test. And for that, we're testing the uppermost joint, so CO, C1, C1, C2 of the cervical spine to see if it's going to reproduce any of those symptoms. Next, we're going to use our palpation of those joints. We're going to do what's called end play, which means we're going to take the joint to the endmost range of motion, stress the joint capsule, and see if it stimulates any of those same sensations of the headache or any of those same symptoms. So what that palpation would look like is we're going to take the joint all the way to the side, end range, take it a little bit farther, end range. For COC1, we're going to go to the side and do a little end play to see if we can feel the end of that joint capsule or that space and to see if we're going to reproduce any of those symptoms. If you have any questions about any of these assessments or anything at all, feel free to reach out to the clinic and we'll see you next time.